Muito obrigado, professor Carlos Gadelha.
Thank you, Professor Gadelha, and thank you for your brilliant lecture. It completely fulfilled our expectations in that you presented a new perspective about the relations between health and development, and you also gave extremely complete and practical examples of a process that Brazil's been going through. And the objective of the seminar is to insert these aspects into the agenda of development of South America. And ISACS will be leading this process in the strategic agenda with our work plan approved by the health ministers of the region. Now, we will start a Q&A session. I see that we have many questions, and for all of you watching us, please do send your questions, comments, and suggestions. But I would like to start by saying that within the practical framework adopted by Brazil, I think there is a specificity that may not be common to all of the countries or to most of the countries in the continent, which is the role of the public lab. I mean, maybe you could speak about this. The slide that you showed official labs and partnerships with private companies as one of the main players in the process of establishing partnerships between the public and the private. Why have we opted for public labs? Or still, what is the role of public labs in this policy? I've only seen this badge and I'll put it on right now. Well, there are two things about what you asked. The legislation that was approved talks about the levels of public administration, and I am struggling with my team in order to replace the name lab with a public institution, and to see that from a perspective of a science and technology institution. The law wouldn't be approved if we established a direct relationship between the federal and the private sector. It's almost like being shielded within these institutions of science and technology, and this will guarantee that the technology is being transferred. Oh, and you're going to ask me, well, this is important for the protection of the state. Yes, it's important for every state to be protected, even against themselves. This is in theory. You know that if states do not have restrictions and controls, they'll simply take off. And I'll give you some examples. Brazil had an experience with insulin. For 20 years, Brazil supported the national production of insulin. And a national company that used to fill us with pride. I was young at that time, and I used to visit companies in 1999, if I'm not mistaken, due to the fact that we couldn't use the procurement power of the state. This company lost bids, and they went under a price war. The company was sold to its competitors. I don't think that was a private loss for the partners, but it was sold, and the next day it was closed, and on the third day, Brazil went back to being an importer of insulin, and on the fourth day, the prices were skyrocketing, which shows that if I had a static perspective, I would say, well, we can just import insulin since it's cheaper. If I have this dynamic perspective, I'll tell you, if we are not empowered to produce insulin, we'll become hostages, and what used to be an advantage in the past will become an imprisonment. If I had a public institution, for instance, Oswaldo Cruz Institution, involved in this process, I could say the company can be sold, but the technology stays. So it's just fundamental, temporal, for this arrangement to be mediated by a public institution. And here we also have a challenge. These public institutions cannot be underqualified, and I think that there are two essential qualifications. They need to become more and more like institutes of technology, and among the set of institutions, we have Oswaldo Cruz and Butantan, but we have institutions that are not technology institutes. And more than being production institutes, they need to be institutions that have the technology to do what the country needs, and this is fundamental. And the second thing is that we need to change the administration model.
Carlos Lessa, which was one of the great economists that helped us, also linked to CEPAL, he would say the following: you don't allow the market to work and to buy efficiently, you don't allow it to sell efficiently, you don't allow it to perform technological partnerships efficiently. No one who will do partnerships with the current bidding law we have, and then you allow the state to be privatized. So this model of management that these public institutions will become more and more technological centers is what we have in our agenda. We announced recently investments to recover the the drug and chemical production in Brazil with the Oswaldo Cruz Foundation. I've been in Paraíba State up north. I was very happy with my visit. I was also in Ribeirão Preto. So we're really using a magnifying glass, and we're trying to find public institutions which can absorb technology to ensure that the style that we are, stimulus that we're giving to the private sector, that if we can change the technology, the strategy tomorrow, we can keep the technology within our country. I have a question that comes from Argentina, Thomas People. In the relationship between the public and private sector, what is the role or function of each one? Specifically, what incentives does the private sector have to transfer its knowledge and licenses to the public producers or manufacturers? Well, to be very brief, the market. We know that the main obstacle for innovation that applies to any company is the market horizon, so which means 10 years of investment in technology, and then the company has to decide who to sell it to. The science and technology programs that have failed, that we see globally and in our region, it's because they deal with technology as if it was a sausage factory. I start producing, generating knowledge, and later on I will generate the production, and the sausage will be ready, and I will then try to sell it to the consumer. But we have to have an inverse model, and also have to ensure competition. I will talk a bit more about this later on, the model that we've created. But competitively, I have to fight for the market so that it will use my innovation. What have we done? So as we establish a market horizon, these partnerships, productive partnerships, can last about 5 or 10 years. So for 5 or 10 years, I can ensure the public market if that product is essential for health, if there is technology transference, and if there is savings for the public budget. Because the cost of market with the company can be reduced when we have this type of partnership. The stability of sales, they don't have to gain only in that first year. They can amortize their profits in a bigger amount of time. So I can change that, the guarantee, the assurance of the market with better prices and technology. Our whole vaccination program is based on that model. And this is very inspiring. The Oswaldo Cruz Foundation is creating a new company, and with the previous legal framework, we would not be able to buy that product. So I need to have an assurance of the market, of the public market, to be able to have an arrangement so that the technology will be transferred at a price that is favorable for the national health system, SUS. I have a question from Christophe Haas from PAHO. With your experience of the last 6 years, what are the main challenges to implement this program of the health complex that would benefit the countries of the UNASUR region or the BRICS, where there is productive capacity installed to be able to deal with their health issues, to be able to ensure greater access to health? So what are the main challenges? That's a difficult question, but it's an important one. Since I'm here in this South American institution, and speaking of in this point of view, I would say that it's not easy to do an international cooperation when we talk about public procurement, the use of the public market. I'm talking about the different fees and so on. So it's a great challenge to build an agenda that will be global, and at the same time that will reinforce the weight of the region. That's the first challenge. And the second challenge is that, how can I say this? We shouldn't have a destructive battle within the regions. For example, you talked about the BRICS. I can't allow that only the price variable will become the variable to establish development policies. For example, I want to know what's behind that price. If behind that price there is a universal system, there's respect for the environment, there is worthy salaries, then we have to compete. But if behind that price I have 60% of the population without access, I have no respect for the environmental laws, I have huge salaries and wages, I don't want that price for my country. Besides that, behind that price, there is a society structure. So I think the thing that we see the most is the price. We have been able to reach competitive prices, but I always want to discuss these issues. For example, in the reform that we're proposing for the Chamber of Price Control, I want to be able to compare prices with a country that has a universal system, not with the countries that do not have universal systems. I want to compare prices with the type of country that has a social structure that is desirable for that country. Those that know us in the negotiation, this is also a period that we had the management of Temporal and Padilha. Only in Matinib, one product for oncology, the government was able to save 50% of the price, around $100 million, and also made it possible to produce a generic drug for oncology in Brazil. So I think that is the challenge, to be able to turn this into a regional agenda. This is very complex, but I think it's a challenge we need to face. And the challenge that we do not choose the price variable not unlinked to the structure of the price in regards to society, which is what we want to do. A question from Brazil. With this understanding that this sector of health is an important vector for the social development and economic development of the country, which is the base of this policy that we're developing in Brazil. So in this sense, what is the experience of associating economic policy with social policies? How can we use this better in our region? So this kind of goes along with your last answer. This challenge of building a regional agenda, dealing with health and development with policies that are destined or geared to do this in a more modern social view, breaking a little bit this false vision. In Brazil, we have a bad habit to use three categories, which would be low, medium, and high technology, as if video surgery would be high technology and a clinic out on the outskirts of a large South American city would be considered low technology. So they're both, they're very complex, but they are in different things, but they're in different levels and categories. So from this Brazilian point of view, how would you see this build-up? And how do you see this issue in the South American perspective? We're not talking about 200 million inhabitants. We're talking about 400 million inhabitants now, which really changes the picture. I think what the Brazilian experience brings us, I'd like to ask my advisor, which has been helping me a lot in this international project. What will be when will be the event with the Gates Foundation here in Brazil? 20 days from now, we will have a project that will be launched with the Gates Foundation. Why am I saying this? Because we're able to establish a partnership with the Gates Foundation. Instead of establishing projects and asking for money to fund these projects, we communicated the regional agenda and the Brazilian agenda, and we will then establish a project that will have resources from the region and also from the Gates Foundation. We have had some issues previously on how that would work with the Gates Foundation, but what should guide this project is the universal access to health. And that's where I start talking about this. Do you know what we're going to talk about in 20 days? What was chosen for this project that was launched was the issue, the topic of premature births in regards to child mortality. So I'm not going to add that to the government program, more doctors, but the premature births is the main issue. You know what's one of the main innovations that scientific knowledge brings us in regards to the research that was done by the Fiocruz network is that the main cause for premature birth is unnecessary C-sections. Do you know what's the percentage of C-sections that is done in the private health system? More than 90% of childbirths are done by C-section. So I have to reduce C-sections and increase the numbers of natural births. So this is innovation. That is innovation. I'm changing from one technology to another, a better technology. It's better for the women, for the child. You know this better than I do. And I'm doing this partnership with an international foundation that previously had more of a vertical view in regards to the partnership. But now I want to be able to deal with the national policy, with the different Cegonha networks. I want to also have discussions with the women and child policies. So I repeat the question. So I think that what the Brazilian experience can state is the following. We should not forget our starting point. We cannot deal with this as an economic agenda. I think the issue of universal access and the construction of these universal access is our regional agenda. And the productive base and the base for innovation should be dealt as a mean to get there. I've had some meetings where we talk about this concept of universality, which is a bit vague. I could have universal care only in the basic care, but that's not our idea. The idea that we have of this universal care is to have a comprehensive care, and this is not low, medium, and high technology. It's comprehensive. It involves care, prevention. So I've learned that comprehensive is not low, medium, and high technology. It's to see the citizen, the person, and not see him in different parts or in a divided manner. So I think we really need to do a radical movement to change our system, to come to this universal system. And to do this, we have to participate of the hard agenda of the economy that relates to health, which is the industrial policy agenda. I actually prefer to use the development industry, the productive development industry. So seeing this service sector as an area that organizes itself in an industrial manner, we see this all over the world, and maybe we can try to see how the health authorities and I want them to come out of their international instances or environments in regards to health, and we want to try to invade the gates of the World Labor Organization, of the Finance Ministry. If we have an intersectorial perspective of health, we cannot get into the doors that we need to get into. And I think that is also applicable to the international experience. I want to highlight a comment that Professor Gadelha said, which is to really radicalize our concept and the process of implementation of these universal systems. I also want to call the attention to the fact that we have a debate today. They kind of redressed or changed the appearance of something that is already old, which is universal insurance, which you could have a precarious coverage. And what we want is to have a comprehensive universal system that is funded by public resources of good quality for all citizens without any type of differentiation. And something else that you said is that the ministries have to really have an important role in this new vision, leaving aside or maybe broadening their view of the health system and to go beyond the comfortable walls of traditional healthcare. We need to broaden this view so we can build this new vision and this new approach. Jorge Bermudes from Fiocruz Brazil, he makes a comment here which I think is interesting. He's congratulating the quality of the event, and he emphasizes that the partnerships for productive development and the goal should be to really work on the whole chain of production, emphasize the chain of production, and also to establish partnerships in the area of biotechnology. And he also wants to remind us that we are in Brazil reviewing the regulations of technologies and innovations. So these are issues that are also related to this whole perspective. I have a question from Suriname. Now they have the pro tempore presidency of UNASUR. Our colleagues from Suriname, Medium, makes the following question. Brazil made use of the scaling economy so that they could successfully change a capitalist research and development idea and change it for a socialist political thinking or perspective. So Brazil was able to use the scaling economy so successfully he could change a capitalist research and development strategy to a socialist policy idea. So what strategy can we use to do this in smaller country, and how does this relate to other international models? And there's also a comment here to call the attention to the asymmetries that we have in the South American continent. We're talking about social and economic scenarios which are quite different, and possibilities in regards to health which are quite different. So how can we use this strategy to develop a policy for the South American continent? So she's drawing the attention. She's saying that we transformed a capitalist research and development strategy to a socialist kind of approach. So these are very complex questions, and I have to try not to be too controversial, but I want to thank Bermudes. He is very kind, and he's a great partner in this strategy. So he talked about the second generation's PDP, and I'd like to talk about this very briefly. So when we launch these PDPs for biotechnology and we call them second generation, it's not because they're biotechnology strategies. So what we're doing is we are asking from the public institutions technological training. So the first research and development institutions, we were paying our previous debts. We evolved in regards to drugs and chemical products. So what I said is, let us start to pay the debt of a disaster that happened in the end of last century. So the public laboratories would start to formulate the products that the private companies will start to verticalize the production. So it's not like we're going to do everything all of a sudden. We're going to start, and when we see as we go, we can do some changes along the way. But these institutions, they require technological competitiveness. So we see these public agencies more as technological agencies. And more the private sector is taking on an important role in the production. But the technological center has to be controlled by the state, and they have to be able to produce. Who does not produce anything also doesn't know how to do anything.
So this is something that I'd like to highlight. We are in the middle of the process. This was a process that I used to say that we either take off or our heads will be taken off. This is about technological competition. The public market will not be regarded as a traditional market reserve. Public and private agents will have to compete with technology. With no competition, there is no innovation. This is what Schumpeter used to say. So you should all compete. If you have a better and quicker and cheaper product and offer it to the unified health system, you will get the market with a strategic perspective that we need to strengthen the segments that were weakened at the end of last century. And speaking about the second generation, about Suriname, I'd like to say the following. Well, I'm sorry to say that even though I'm a socialist by conviction, we took on the challenge of not sleeping well. I mean, how do we come up with a policy for health development in the context of a capitalist region, a capitalist country? We're dealing with private companies that need to have their profits guaranteed. They have papers in the market. How do we domesticate the beast? I mean, the beast's been domesticated. In a post-war scenario, welfare state was created in Europe, and in a certain way, the state was thinking about how to build this welfare state in the European continent. In Brazil, we think about how to domesticate capital so that it has new standards of gains that allow for public benefits. The idea is how to transform private gain into public benefit. And with that, the state acquires a huge power in the health system, the power of intellectual property, the power of technological infrastructure. All of these surveys that are out there have been developed somehow by a public university in the world, as well as in Brazil, when you have some type of public survey or public research. So I will refer to my colleague from Suriname by saying that we struggle to domesticate or to tame capital and not to destroy it, since there is no developed country today that does not have a strong capital and a strong state, quite frankly. So, by leaving this perspective of zero-sum, I think we will enter, or we are right now, at an agenda of the post-war scenario of Europe, where the productive system was developed, and at the same time a welfare state was developed. I think that this is the agenda that we want for health, and if this agenda will help us in the future to build a more egalitarian and better society, and I'm sure that it will, or even a transformation, well, the future will tell, but this is the agenda that we have before us. And the aspects related to the South American asymmetry, well, that's very instigating. I've been saying that we cannot deal, or we cannot regard a country with 200 million inhabitants similarly to what we do with a country such as Belgium, for instance, and that can be applied to Suriname too. Belgium, for instance, they should not produce everything. That would be crazy. If they need insulin, well, that's what they have to purchase. But if you have to purchase for 200 million people, you can come into serious problems of not having availability of that product in the market. And the challenge that we have right now is we should start thinking about 400 million people. Or maybe say that in Suriname we should think about how they can contribute to that process, because you cannot expect a smaller country to produce everything related to health. But if they are seen from the regional perspective, where Suriname, for instance, has a certain specialization profile different from that of Brazil and from that of Cuba and from Argentina and so forth, we can establish an institutional arrangement that will guarantee that we have health safety. Behind everything that we're speaking here, you need to have health safety. If you do not have a technological base, well, sovereignty is not only about defense. Health is about safety. How can I guarantee that our patients with Chagas disease in our region will have access to products if there is no more profitability for those products? So we can say we can establish regional policies and at the same time respect niches of specialization according to the competencies and the size of each country. Of course, that's not a final answer, but at least I'm trying to help with the discussion.
Vamos lá. Que nos assistem aí pela internet estão começando a participar. Nós temos uma pergunta.
People watching us online are starting to participate. We have a question from Colombia. According to your experience, what's the main factor that prevents South American governments to regard research as a regional development factor? Well, this is one thing that afflicts me as well. And the second generation of PDPs and the research agenda, and I'll be quite radical about this, the agenda of the industrial complex will not be successful if we're not successful in the research agenda at a regional level. I think that we're now regarding the research agenda as the core of the strategy. The problem is one of static versus dynamic efficiency. The result of the survey or the research will have an impact on the health system over decades. If my action for health is, it could be a one-day program. If it's to produce, it could be for 5 years, and if it's for research, it could be for 50 years. I remember that between the first research that identified the first helix of the DNA and the final surveys, it took 50 years. And we cannot think that it's the bureaucrats who will solve anything. We recently had a problem in national action. Either the society will scream or the bureaucrat will sit still. I think that this agenda of research and health needs to be embraced very strongly at the regional level. I think that our public health departments have not yet prioritized research the way it should be prioritized. This entire strategy will be aborted and will not be successful because the scientific and technological development is always sped up, and technology changes every 10 years. If you just stand still, you will certainly be lagging behind in terms of technology if you're not updated. Updating yourself. You need to be as fast as everyone else. So this agenda of research is not equated yet. And sometimes what you spend on one single drug is the grand sum of what you spend on research. And this is a regional agenda and temporal. We need to agree that now we need to focus on research, and not only on hard research, but on the type of research that says that we should have more natural births and not so many C-sections. And I'd like to say that at the end of the year and at the beginning of December, on the first week of December, we're going to have a major event that we have every year, and this one is going to be even more important. And this will be important for 2014 as the big year of research for Brazil. We will be releasing many publications, and we'll sit down with the academia and the government and the industry, and we're trying to mobilize the society. And a moment of political change and political discussion to start placing the research in the health sector in its right place as something prioritary. And I rely on ISACs to help us strengthen research and health as something that the region needs. I do not have an answer for that. I'd like to say that I share the concerns with you, and if we do not advance in this agenda, or advancing in this agenda will be a solid base for building our future agenda. Well, I'd like to remind you that this afternoon we'll speak about this and other subjects related to our focal subjects today and tomorrow. There is a question. You put a lot of emphasis on access as a core component that somehow feeds or guides this entire strategy. On the other hand, somebody mentioned the BRICS. When you look at India and China, for instance, with a very consolidated and aggressive policy for the production of generic drugs consumed globally, there is no relationship between these countries between the economic policy or industrial policy with regards to the pharmaceutical industry and the health sector. I mean, these countries have very frail health sectors when it comes to access, universality, and integrality. They're facing many challenges. So I'd like to hear your take on that. If you could speak about access as a central component of the Brazilian strategy and how that could be incorporated by the other countries in the continent. Well, we are an agency that's here to provide international coordination, and we need to be very elegant. So the model of China and India, which, by the way, are discussing how to expand access, they have nothing to do with the model that we presented here. That's why when somebody asks me, what is the biggest regional challenge, I wouldn't say that it's innovation or research or production base. I said that it is the universal and integral systems. And about price, I said, what's the social structure behind that price? So I have to say that, and this is from a more macro perspective, I bring to the table a model of society that we intend to create. I do not think that the production system, the so-called competitive system, where 70% of the population have no access, is the system of choice. That's why in the first slide I mentioned that the system, the concept of system says that it should meet the requirements of the population. I do not want to grow 10% per year. If I need to do that at the expense of the needs of the population, that rate of growth is not interesting. But I do have something to say. I think that we can have a social inclusion model, and 40 million Brazilians have now moved to middle class levels, leaving the line of extreme poverty. I think that we cannot have a trade-off between growth and equity. Equity, and this has been shown by Keynes in the past, expenditure and distribution of income is good for the growth. By the way, you should read an article that says that the crisis would have been solved in a much better way if we had spent more in the world rather than making a financial arrangement to make the banks more comfortable. So expenditures and income distribution are good for growth. Well, I think this is very important because I think that this new perspective about health and development focus on reducing inequality and on social inclusion and on access. And the core of all that is the strengthening of the universal health systems. I think this is a take-home message. Do we have more questions? Well, we do. So in the meantime, I have to say that the economic area of the countries of our region, even even though they're full of people with goodwill, they'll never understand the social dimensions of research in health. And since my colleagues are here representing the production sector, and they'll be given the floor later on, no one's complaining that they're having losses and that they're having to close down their companies. On the contrary, there are companies that used to be in the ICU and now they're being treated with home care. There's an interesting question by Ricardo Oliva from the Health Secretariat of São Paulo, and he asks, there's no development without people. Where are the people within the framework of technological development? Okay, how are you, Ricardo? You're always very emphatic, and you asked a very good question. Well, the workforce and the health sector, from a systemic perspective, the human resources in health are fundamental. When we justify health, we used to say that 10% of the qualified jobs in Brazil are in the health sector. So health is the core of the situation. I agree that we need to reinforce the training of human resources. The second generation of the policy, if I can call it that, we placed a lot of focus on research, and this is, and once again, our international and national organizations need to leave the comfort zone. When we speak about health professionals, we're talking about doctors and nurses, but where are the biotechnologists and the engineers and the bioengineers and the clinical researchers, the physicists? I mean, the agenda is much bigger than that. Our agenda ranges from physicians and typical health practitioners to technologists. In the production sector, the main bottleneck that we have is the highly qualified technical personnel. In the next GSIS, in addition to equipment and materials, there will be a specific agenda focusing on human resources. With this expanded view of human resources, and just so you don't get depressed, the development process is always imbalanced. I used to say that in Brasilia, when there are those depressive meetings, I used to say that we only have these problems because we're doing something. If we weren't, we would have nothing to discuss. So as we advance, this bottleneck becomes more evident, and I'm relying on São Paulo to help us with nationwide strategy for the training of human resources in the health sector.
All right, we have more questions. I think we already talked about this. It's a question from Paraguay, Antonieta Rojas. With this perspective of research and social innovation and health, the small countries, we're talking about the asymmetry once more. There's a difficulty in defending their insert in basic research. So how to develop a strategy for research in small countries within the asymmetry that we see in the region. So it's a bit of what we talked about, the scale, and also how to, when you construct a regional agenda, you can deal with countries that have a large productive base or with a bigger population. Yeah, I think you've answered that already. I don't know if you wanted to say anything else. I think this effort of establishing regional networks, I'm usually very optimist. But I wanted to say that the networks that Brazil is building, we have, for example, an oncology network. We created the first health policy network. That's an innovation. We created a network. We created a bill to be able to create a network for universal health access. So this is something that is not traditionally what we consider a hard innovation, but I think the participation of other countries, I think PAHO helps us a lot to have these regional networks that allows us to do this in a more focused manner. Very well. I think we're done with our questions now. I would like to ask Mr. Carlos Gadelha, my friend Carlos Gadelha. I would like you to please give us your last closing remarks of this excellent event. And also I want to draw the attention that we will have other workshops and sessions this afternoon and tomorrow. And also we will put all the discussions that are taking place in our website. So now I want to talk about all the slides that I did not have time to cover before. No, I'm joking. I would actually just like to thank everyone. I'm in an environment that I feel very good in. We're friends, and there are a lot of people here that are very committed with a model of development that gives priority to the social aspect. So I wanted to greet the whole team, the leadership team, Monica, Joval, everyone that participated in this process. I don't know everyone's name, but Temporal never went through any place without leaving it, without changing it in some way. So I see that he is being very careful here. He's a Ministry of Health, or wasn't a Minister of Health, and he left a legacy. And now this becomes a regional agenda. I also wanted to mention the Minister of Health, Alexandre Padilha, which is also very supports this agenda and this international cooperation. I would just like to say that we are here and we're available, and we want to continue to discuss these issues to make our region a more developed region. Thank you very much. We thank you all for your presence, and we will continue to be together this afternoon and the rest of the presentations. Thank you.